And that's where I learned quite a lot of the database skills. And then design skills was a bonus because, as Steve Jobs says, design is how it works.
So let's get real. Our value as doctors has significantly diminished over the last decade. So how can we turn that around by upskilling and creating rewarding and impactful careers on our own terms? Welcome to Disrupting Doctors' Careers. I'm your host, Dr. Abeyna Bubbers-Jones, and I'm on a mission to connect 1 million talented doctors with the best in diverse career opportunities. So, welcome to today's episode of Disrupting Doctors' Careers, where we are specifically focusing on setting up your own clinical practice and some of the challenges associated with that and some of the things that you need to be thinking about as an entrepreneur. I always say the actual work, the actual clinical element of it is the easiest bit. And then everything else around that can be a really big challenge, especially when you're starting up. So to discuss this journey, we've got Dr. Ken Laji, who is a consultant endocrinologist, and he is the founder of ClinicYOU, which is a great clinically led CRM, customer relationship management software and platform for clinicians to really use it for their own clinics on the go, anywhere, everywhere, and with ease. So welcome to this episode, Dr. Laji, and really good to see you again. It's been a number of years.
Thank you. Thank you very much. Good to be here.
Yeah, awesome. So, I mean, let's get started and revisit your own journey, because, most activities like this, like most businesses, tend to come out from someone's own journey, someone's own pain point, someone's own challenges, and this is you. Because not that many doctors in the great scheme of things will set up their own business. So I'd love to hear from you, like as an endocrinologist, what led you to actually first go into private practice and then end up, setting up your own software, which again is unusual.
Yes, thank you. So endocrinology, as you well know, is a specialty which is data-driven. We all have structured minds and we think logically and things like that. And layered on top of that, I've always been into design and liked presenting data in a sort of structured way for efficiency and looking at things and running your clinics more efficiently. When I set out in the NHS practice, was appointed as a consultant, I realized that there wasn't much which actually enhanced your efficiency piece in medicine. You would be drawing data from a lot of places, trying to make sense out of it, shuffling lots of paper. And that is how the NHS system was working at that point. So on the NHS side itself, so I created my own software 22 years ago, which is still running in my department, used by everybody else.
Can I just stop you there, because you've just glossed over something amazing. So in the NHS, you created your own software. Tell me more about that. Like, how did you do that?
Okay, so when I was a registrar, I realized that one of the jobs of the junior doctor was to create a patient list. From there, you can present cases to the relevant people and manage that. So I created a software called Lister, and it was a FileMaker database with a good UI and things like that. It was easy enough. FileMaker, some of you might know, is a software that Apple developed originally, and then it was ported to Windows as well. So it's a development platform for the rest of us, as it were. So I created a software called Lister. And when I was faced with this challenge of running a department without efficient software, I used the same platform, Lister, and made it into something called DIME, which was meant to mean Diabetes Information Management Engine. I called it DIME because it cost me about £2,500 to implement.
But where did you actually get the skills to actually start developing your own software?
Self-taught.
Sorry?
Self-taught.
You self-taught. Where did you have the time to do that as a clinician?
Okay, right. Running another piece back. I'm reasonably good with time management, so that helped, I guess. And I'm also an engineer at heart, so I used to do sort of mechanical, sort of electronic stuff, make radio transmitters and things like that as a child. So I've always been in, a bit of a tinkerer. And I sort of branched into software in the back of starting my SHO job. Initially, I was in a department in cardiology in London, in the east of London, and the consultant that I used to work for, introduced me to the power of computing in clinical medicine. And he had a database for, thousands of patients with cardiological data. From there, we used to easily query the data and create publications and present at various meetings and things like that. And that's where I learned quite a lot of the database skills. And then design skills was a bonus because, as Steve Jobs says, design is how it works. Quite a lot of people don't get it. If you don't have design, no matter how good the software is, you can't use it. So I began to sort of marry the two things together, logical mind, design mind, and then began to sort of self-teach software development.
So what I find really fascinating, and I think it's really important for a lot of doctors listening to really appreciate this and see how they can take this into their own action, is because like you already had these skill sets and knowledge and interests that you then married up with medicine, plus you managed to connect with a mentor who also had a similar interest, and that's where the magic happened. So these two skill sets were married and then created opportunities for you to actually develop both at the same time, which I think is incredible. And I feel that a lot of doctors are missing that opportunity to take some of the things that they had before they even walked into med school and use that or marry that with what they're doing now and their interests to create something new and really valuable for healthcare. So I think that's really fascinating and really inspiring. And like just fast forward to I say near today. So I mean you've clearly found a gap in the market. I mean, just talking from a personal level, having worked in the NHS and outside of the NHS for a couple of decades now, actually, and I'm yet to come across a really good piece of software that makes your life easier as a doctor and not harder. It is difficult to do, but I honestly see that the pieces of software that tend to be clinician led or designed, at least, tend to be the better ones. So I'd love to hear more about why this was important to you in making sure the design was very much focused on the needs of the clinician and obviously of the patients, because obviously they also have access to the side. So yeah.
Yeah, the clinically led software tends to sort of be much more aligned with your workflows and your particular needs. To give an example, DIME, the NHS departmental software that I developed, I never train any of the new staff, including SHOs and registrars and dietitians and specialist nurses who come to the department. I just give them a username and password, and then they're on with it.
Okay? Yeah, that's how it should be, right?
Yeah, absolutely. Traditionally, within the NHS, you have about 3 hours of sitting in some meeting being told how to use the software. So that was interesting. Somebody will email me, can I use this? Set up username and password, that's it. I never hear anything else. And it's a collaborative software, so we all work on the same software. And um, quite recently, it's about 3 years ago, the hospital introduced something and wanted to replace Dime. They came and spoke to me. I said, these are the core functionalities that we need. For instance, set ourselves some reminders and send each other some messages. Everybody works on the same page. None of that was there. And I said, well, speak to my team about it, if you really want to replace them. There was a big riot and everybody said, we don't want this. We're going to stick with what we have, unless you can reproduce the core functionalities. Simple things like, set yourself a reminder doesn't exist in most clinical software, whereas we always want it. I mean, we traditionally relied on other staff members like secretarial and other admin staff to actually jog your memory to catch up on a patient, for instance. That sort of thing is fundamental and still not fully implemented in many of the software. So that's where it sort of, if you are a clinician with ability to create software, it's easy to see where that kind of functionality might come in handy.
Absolutely. And then going back to the clinical, so at the moment, like we've talked about this earlier, we've seen this massive sea change in doctors who are particularly interested in preventative healthcare, specifically lifestyle medicine, functional medicine, nutritional medicine, and they are looking to set up their own clinics and practice medicine as they feel it should be practiced, compared to what they generally would be expected to do on the day-to-day, which tends to be more reactive. And so, like, what would you say are the biggest challenges that doctors at that initial stage, setting up the business stage, tend to face, also based on your experience?
Yeah, medicine is a funny space in the sense that most of the people who go through the journey of training in medicine are not self-marketers. They don't think about marketing themselves. They don't think about entrepreneurial sort of or setting up their own channel of selling their skills. So marketing themselves is the main, or putting yourself out there as the key person who can solve other people's problems, and that I think it's probably an NHS phenomenon, a UK phenomenon. I don't see this so much in other countries because of our the point of care sort of system that we all sort of subscribe to. We tend to sort of be almost self-effacing and not very forward thinking in terms of getting started. It's not that changing the mindset is an important thing.
I mean,
how do you make
No, I was going to say along those lines, like mindset is a huge one of the biggest problems that we see amongst doctors in general when it comes to, again, considering other options, seeing other opportunities, and actually taking those steps to do something different, especially when they know they're not really flourishing or thriving in their existing environment. And I'm there's so many complex reasons why that is, but a lot of it is to do with, one of the reasons that doctors aren't self-marketers is because, as you said, they're in a health system that doesn't require that. Like our job is to train and see patient service delivery. So there's some academics, but there's no need to sell ourselves in that sense, like, because the money, we get paid a check every month, we get our salary every month, and we don't even have to worry about that in that way. And so no one's paying attention. But basically, we're not paying attention to anything else other than the work, which in some ways is great. So then you can focus on being a great doctor and providing that service. But as an individual, especially if you're not really enjoying what you're doing, or you're missing the opportunities where you can also make a great impact outside of that is where that opportunity is missed. And especially when we come to lifestyle medicine, preventative healthcare, which isn't always readily available in the NHS. We know that because the NHS is set up really to sort out mainly acute problems. And obviously there's a huge burden with chronic problems. And so with preventative healthcare, you're really getting to the person before the problems arise. And that is where you can make the biggest impact. But as you said, like actually starting to market yourself, it can be really scary, but the tools are there, the resources are there. And so, I mean, how would you recommend, again, a doctor at an early stage, they're setting up their business actually to go ahead and start marketing themselves?
These are the sort of usual pieces of, becoming a key person of influence, as it were. You need to have your pitch. You need to be able to explain to anybody in a few seconds what you do and hold their attention. And they want to sort of, instead of just smiling, they need to be able to sort of ask more questions about it. So a perfect pitch of what you do is important. Creating that is important. And secondly, publishing your thoughts in whatever channel. These days, it's very, very easy. Every doctor's got agency of trying to sort of publish your thoughts and ideas and things like that. When I started, it was a little bit analog. I did a lot of lectures in my region, and locally and regionally and nationally, which sort of began to sort of project my name a little bit. So quite a lot of GP practitioners knew about me and my ideas, and sort of presenting endocrinology in a sort of accessible way with well-designed talks, explaining complex physiology in simple terms. Simple things like, diabetes is a spectrum of disorders. It's not just type 1, type 2. And now everybody in my region talks like that, which is very, very nice to do that. So create your pitch, publish your thoughts, and be present in that, so that people can actually see you out there is an important thing.
Yeah,
and then,
I mean,
sorry.
I was going to say, we do a lot of work with doctors through our Doctors in Industry Fellowship Program at the moment on those things. It's one of the first, actually the first 2 modules actually is mindset and clarity. And then the second 2 modules is personal branding, networks. So, yes, you said like those, it all starts with the clarity and the mindset first, and then you get into building up that brand that fits in with the audience that you're trying to attract and to serve. But it is like building up that confidence as well in doing it and articulating your offer and your USP and your value proposition, which I know doctors do find, especially at the beginning, like really, really challenging to do, because it is another skill that, actually we do in medicine. As in, you take a history, you do your investigations, you come to your differential diagnosis, and then you prescribe, right? And it like that is still a selling process. You're still qualified, you're still going through that process. And you're still selling yourself before they've even got there, because you're a doctor, you've got how many years of experience, you've got that credibility, you're in the NHS. That is also still selling yourself, but it's something that we don't consciously associate with selling. And so the difficulty here, like this is like you are actually selling you as a person as well as the doctor, which is, I think a lot of people don't even know themselves because they spent so long focusing on their training and their medicine that they're like, actually, who am I? Like, what am I representing? What am I wanting to do? Who am I looking to help? And it's those key questions that can be very challenging. Like, for example, when you started off with ClinicYOU, who are you trying to help then? And who are you trying to help now? Has that changed?
Yeah, to some extent. What we've realized is that the traditional ways of setting up a private practice for the consultant community is pretty much set in stone. Basically, they would put feelers out to local hospitals. The hospitals will then assign a secretary, clinic space. They almost replicate the NHS workflows on the private side being wedded to another institution, rather than thinking you are the entity that is bringing value to the whole thing. They become a consultant at Nuffield or one of the circle or wherever they happen to practice. And all of the marketing is done by the institution rather than themselves. And if they move from that area, they'll have to start from scratch, as it were, and most of their medical records would be on paper in the depths of the institution that they were consulting from, and that pace is very difficult to penetrate. So we almost sort of stopped directly marketing to consultants body. Don't get me wrong, we do have a lot of consultants using the software, but those are slightly different thinking individuals. They can see the value in using a CRM system in their practice. And recently, the hospital that I consult from introduced a clinical information system, which is, not surprisingly awful. And suddenly, they cut off the paper-based workflows, and suddenly they realized actually the value of having a cloud-based information system that they can relate to would have completely solved that problem. I said, oh, we don't need to use that. We're on the other software anyway. So, burning the bridges there for them suddenly focused their mind that they needed to have a system which is, yeah. So yeah, in terms of marketing to a cohort of consultants, that's changed. We've opened it up to all host of other domains, including lifestyle medicine and occupational health. And I mentioned to you earlier on, we were chatting about the occupational health clinics, using some of them are abroad. British companies were operating abroad with large employee base, using it for their occupational health sort of clinics. That sort of thing's been happening. Yeah.
Okay. Well, that is great, because when we start off with a project or a venture, it's guaranteed to change, isn't it? Depending on what the market does and how it acts. So, and I would encourage anyone that's setting up their clinic, have a strategy, do your market research, have a strategy, but be clear that it will change and embrace it, because that is business. And so moving forward with, what would you say any different on that?
Sorry, I was going to say the startup pivoting to keep up with the customer needs is an important thing, and that is an important thing for clinicians to think about as well when they are in their practice. ClinicYOU has this sort of dashboard which, provided you coded all of your clinical diagnosis, which they do obsessively, you could tell you which is the number one clinical entity that you're working with. And then if you have social media channels where you publish your thoughts, you could then segment your thoughts around the number one clinical entity that you deal with, as part of your operations. So that sort of thing is also an efficient thing to do.
Yeah, absolutely. And just looking at the future and the vision for ClinicYOU as a clinician-led software and platform, what can clinicians and doctors expect moving forward with using the software?
First and foremost, it is a CRM software, so it helps you run your clinic efficiently.
Let's break that down, because not everyone knows what CRM actually means. What does it mean in real terms as a customer relationship management platform?
Yeah, and I've said that because you introduced ClinicYOU like that, and I also
Yeah.
I'm sure quite rightly think that your readership will know what a CRM is. Whereas if I ask that to my immediate colleague at the hospital, he or she wouldn't know what a
Yeah,
CRM
the
is. It's
readership will
a
not
relation.
know what the CRM is. Most people who haven't gone into
You don't think so,
business,
right?
and even some who have gone into business still won't know what a CRM is. Or you know what it's like with acronyms. There's an acronym for everything. So yeah.
Customer relations management is a well-known terminology for the larger sort of business community. Essentially, as it says on the tin, it sort of allows you to see who your customers are and what the interactions with them are, and how you manage information around them. For instance, you call your bank, they instantly know who you are, what your sort of bank balance is, what your spending pattern is, when did you last overdraw your account, blah, blah, blah. All of that, credit scores, all of those is in front of them on the screen. And that is a CRM system that the person at the other end of the call using. Imagine you do not have that in your clinic. The patient calls your clinic line, possibly will get the secretary, and the secretary, if you didn't have an electronic system which shows all the information in a sort of chronological way, will say, right, thank you for your call. I'll just look at your records, contact Dr. Laji, and I'll come back to you. Instead of solving the problem on the spot and sending Dr. Laji an electronic message, that sort of thing. So that is what CRM does. So clinic management software, CRM software, all of these are synonyms for something which enables you to within few seconds of finding that right patient, understand what is wrong with them, where the last few interactions were, what are the results, and then if you promise something like, I'll give you a call back after reviewing the results, the system should remind you to do that. And that is essentially what a CRM is.
Yeah, no, absolutely. And I think that's great. And so moving forward, like what advice would you give to doctors who are setting up their own practice at this stage and considering how to keep their patient data safe?
Having a CRM is a must. It's not a good to have, because that affects your bottom line, because your time is money when you're setting up your own practice. So for instance, again, as an example, once I've finished my private clinic, as I walk out, I have done all of the admin. Okay, so I don't have to go back to sign off letters or anything, because ClinicYOU have got an AI-based note-taking facility which creates notes for me.
Ooh.
From there I can
so you literally don't have to make any notes in your consultations?
I don't.
As in it gets made, just like we've got this note taker here and it's kind of all done.
That's right. Yeah.
Awesome.
Yeah. Of course,
awesome.
you need to edit it, and the notes is usually something that creates the letter, for instance. So from the notes, edit it again slightly, and the letter is ready. And because I capture the email address of all of the referrers and patients as part of registering them, one click, the letter goes out to the addresses and copies to patients. And as the patient gets into their car in the car park, the clinic letter is there. And as I finish the clinic, at the moment, I use a third-party billing service. So I can do one click and download the invoice information, upload that to their services. And that piece we might, again, take that on into ClinicYOU at some point. So once that's done, that literally takes about 30 seconds. I'm done. Rest of the time is I can go to a restaurant, I can go to the bar, meet people, whatever. So that So that it affects your bottom line in terms of your quality of life. You don't forget to bill anybody. You can reconcile your bank statements because you have the invoice information on software. So yeah, it is a must-have piece of software, and that should be a priority for everybody.
Brilliant. And if anyone wants to get hold of you or find out more about the software ClinicYOU, where should they go?
Right. Okay. ClinicYOU.co.uk and .com will also move you there. And there is a wealth of information there. There are chatbots and human operators who would take your questions. And if you wanted to sign up, just hit the gain access button, and we will give people a demo. And if that fits what they're trying to do, we sort of set up this meet the customer first before setting up an account a few years ago. That is how I know what the market is up to because of that. So I think it's a good onboarding thing. So it's good to.
I think it's great because no, I find that as a business owner, the more conversations you have, that's your market research, right?
That's right. Yeah.
And you don't always gather that good a quality information from like people leaving information. Like it's those conversations right. Where you get the gold. So I think that's a really great onboarding. But some people who may not want a conversation, they just want to get on with it. I'm also that kind of person where I'm just like you talked about earlier, when you're using a software, give me the login and password and I'll use it. If I can't use it, then that's it for me. So it's I think it depends on what people prefer, but I know that people do generally appreciate that human touch and that relationship, especially in the world of technology and the world of everything's go. So yeah, I think that's a really great move. So well done, and thank you so much for joining us today, Ken, and hopefully we'll see you soon. And we'll get your son on as well, who's in Harvard.
Yes, please. Yeah, I'll mention that to him, so he'll expect your call. Yeah, thank you very much for the opportunity and in interviewing me.
Brilliant.
Thank you.